Today we're going to talk about medication reconciliation. We'll attempt to explain exactly what it is and determine the ideal person for the job. It all starts with a patient. One may be ill, another may just be in for a yearly checkup, but a discussion about medications should always be a part of the visit. Medication reconciliation is a process where someone interviews the patient, compares this information to what's on file, revises it if necessary, and communicates it to others. It sounds simple enough, until it's time to determine who that someone actually is. Perhaps it's the primary care provider. After all, the primary care provider is supposed to meet with the patient on a regular basis and know all the medications involved. But is the primary care provider really the medication expert? Maybe the pharmacist is a better fit. If the pharmacist takes on the medication part, then the primary care provider can worry about all the other stuff going on during the visit. But does the pharmacist actually prescribe the medications? There's got to be a way to make this work. If one person is busy doing all the other stuff, and the other person doesn't actually prescribe the meds, why doesn't someone else do it? How about the nurse? The nurse already does a ton of prep work before the patient sees the primary care provider. It seems like a slam dunk. But can the nurse make changes to the plan of care? The same goes for the allied care team. They also help with the prep work, they see the patient beforehand, but can they make clinical decisions about meds? Clearly, something's got to give. Is there anyone out there who can do the job? The patient interacts with multiple team members during the visit, and these interactions represent opportunities. Because maybe medication reconciliation is not the responsibility of just one person. Maybe it's the responsibility of us all. The allied care team rooms the patient. They could review the list of medications with the patient and make sure the updated list matches what's in the chart. Primary care providers evaluate the reason for the visit. When it's time to think about how certain medications affect the body, they could coordinate with other clinicians. Pharmacists have a unique understanding of how medications work. They review drug-to-drug interactions and risks, and they could counsel primary care providers on which medications make the most sense for the patient. During their follow-up, nurses can review any medication changes in the plan of care and take the opportunity to answer questions about meds that the patient may have. Everyone has a role to play when it comes to medication reconciliation. If we leave it to just one person, it'll never get done, and the patient deserves better than that. Medication reconciliation is everyone's job. And the more we work together, the more it works for everyone.